So I've done quite a few videos with Doug Thompson, the founder of the Wellness Dentistry Network. It occurred to me when I was editing some of those videos that I've never really clarified why dentists are so important to heart attack and stroke prevention. And that's what this video is about. Uh, the reason for it has to do with gum disease. As you can see, half of American adults, this is from the Academy of Periodontology, half of American adults suffer from gum disease. So what do we mean when we talk about gum disease? As you can tell, dentists, when they get up and go to work, half the time they're seeing this. This is gum disease on the right. Healthy gums on the left. You get loss of gum, so you get a longer tooth. You've heard the term long in the tooth. That means something that's old. Well, that also means something that's got periodontal disease. You get redness, and you see that in several places here. You can get it mildly as well. This person on the right would say, well, I don't have any gum disease. Actually, they do. As you can see, it's redder, and this gum also bleeds a little bit. Anytime you have bleeding, you have gingivitis, bleeding when you see the dentist. And like I said, about half of us grow up thinking that bleeding when you see the dentist is normal. Most dentists see it so often, they begin to think of it as normal as well. And it's not. So let's go a little bit deeper in terms of what can happen long term. You can get erosion of the teeth and the bones. So here are the teeth, the images of the teeth and gums beneath the on the bottom picture. And as you can see, it gets redder and redder, and the teeth get longer and longer. And the corresponding view of the bones and the teeth is up here. This is the bone, that's the socket, and that's the tooth. So again, as you get these infections in this area, this junction between the gums and the teeth, you get more and more bacterial growth, more and more virus growth, and more damage. Your dentist will actually measure that. They call that pockets. And they'll stick a probe in there. Now this is the gum, this is the bone supporting the gum, and this is the tooth and the enamel here. You want a very shallow pocket. The more bacteria that get stuffed into here and continue to grow, the deeper the pocket gets. And then you start getting erosion of the bone on this side, the bone on this side, and the here. The bone on this side here, and the tooth over here. So that gives us a little bit of perspective of what the dentist is actually seeing when we talk about half of people have gum disease. Does that happen to ring a bell with you? As in half of people have insulin resistance or prediabetes? Yeah, you should be connecting some dots here. Obviously, the medical community is surrounded with stroke, dementia, heart attack, heart failure, etc., all associated with inflammation of the arteries. And we, doctors, like dentists tend to think of bleeding as normal. Doctors tend to think of plaque and inflammation as normal aging. And we tend to think of heart attacks and strokes as normal aging. They're not. And you know this information. Every 40 seconds, an American has a heart attack. Every 4 minutes, an American dies of a stroke. What's the link between periodontal disease and arterial disease? Inflammation. Now, I will tell you, we get balled up into, okay, what is the original cause? Does the diabetes cause the periodontal disease and the inflammation and the plaque? Or does it go both ways? I tend to think it's mostly what I just said. Diabetes causing the other two things, the inflammation and heart attack and stroke risk, as well as the gum disease. But in this presentation, I will show you Brad and Amy, with a friend of mine at my genetics, the genetics lab that I work with, did an extensive review of the literature, and they actually saw some other direction. In other words, the bacteria and pathogens, patho meaning sick, gen meaning make you sick, the bacteria and viruses that cause periodontal disease also cause inflammation. And we'll get to that in just a minute. A couple of history comments. Virchow, you may have seen a couple of my videos on Charité, the hospital in Germany that created a huge revolution in medicine. Virchow was one of the big guys there. And he said 157 years ago, atherosclerosis is actually probably inflammation of the arteries. Well, the New England Journal finally caught on, in 1999, and Circulation mentioned it in 2002. You may recognize this name if you can see it down here, P.M. Ridker, Paul Ridker. He's continued to do a lot of work associated with heart attack and stroke risk being caused by inflammation. Now, just a quick picture of what that means. Here's a normal artery on the left, and it gets more and more inflamed as we go to the right. As you see, in the beginning, there's just a little bit of plaque. But as we get more and more inflamed, we get immune cells attacking that plaque. You actually get bleeding. Inside the wall, you get release of hot, inflamed plaque into the artery wall. That's when you get a clot. And a big clot can cause a stroke or a heart attack. Here's a microscopic way of looking at it. This is the artery wall. And if you've seen other videos of mine, I have these images in several of them. This hole is where the blood flows. All of this gray stuff right here is plaque, but it's stable plaque. You see, this stuff is not going to break out. But look here, this is kind of retracted away from the slide area. That's actually liquid. And what has happened here is the immune system has attacked that plaque. That's what we mean by inflammation. Again, we've got plenty of videos on that. You've got immune cells in there releasing what we call cytokines, cyto meaning cell, kines meaning something that brings inflammation into that area. And their whole purpose is to dissolve that plaque. Well, look at this. This is a tiny layer right here is the intima. That's the wall that's protecting the bloodstream from this hot plaque. Why do you want to protect it from the hot plaque? Because if it breaks through, it will form a clot. And if the clot, and that's what's happened here. This is an artery, and this is the intima or endothelial layer. There were cracks in it. The hot plaque went through, touched the blood, and formed a clot. Now, let me finish up with a couple of comments. As I said before, there's a lot of question about, I mean, the CDC has known and mentioned a relationship between gum disease and heart disease 30 years ago, but they never understood which causes which, and is there something like insulin resistance diabetes that's causing both. Although it's probably that, as I mentioned, Brad and Amy and my friend David Vigorous have shown that it also goes the other way. And here's what we mean by that. The periopathogen is the bacteria and viruses that we talked about that infect the gums in periodontitis. Well, actually, many of them secrete a thing called phospholipase A2. Phospholipase A2 modifies LDL or bad cholesterol into small, dense LDL. Why is that important? Let's go down to the second item and we'll see. You remember this second item here, step 2, the most important initiating event is increased permeability of that lining of the artery, what we call the endothelium or intima. Guess what? Those same oral gum pathogens lead to increased permeability. They do that with toxic effects on that lining and even structural uncoupling. So they lead to damage of the endothelium. They lead to an increase in small, dense LDL. And once you get this process started, there's another thing. It has to do with SMCs. SMCs are smooth muscle cells. Remember that red layer right here underneath the intima is called the media. It's a smooth muscle cell layer. As you start getting more and more inflammation, smooth muscle cells begin to change into something else and increase the problem. One of the ways they change into something else is a thing called proteoglycans. Proteo, protein, glycan, meaning sugar. Remember, we've talked about hemoglobin A1C is a proteoglycan. The more sugar you have around, the more it's attaching to proteins. And when sugar attaches to proteins, it's like frying an egg. It denatures it for the most part, and that protein cannot be used for what it was used for before. Well, back to the pathogens, they stimulate an increase in the migratory smooth muscle cells and therefore create generation of more proteoglycan. We're getting long on this video and I'm going to go ahead and cut it off. But I'll let you know, parts 2 will get into some of these risk factors and we'll get a little bit deeper into insulin resistance, how common it is, and how to evaluate it. If you've made it this far, again, as usual, thank you for your interest.